In our changing world, there's a real need to access virtual healthcare. And today at Sun Life, we're leading the industry with virtual care innovations. Lumino Health Virtual Care, powered by Dialogue, lets employees and their family members connect with healthcare professionals online and receive a diagnosis and treatment for physical or mental health concerns. Online cognitive behavioral therapy and virtual paramedical services also provide effective treatment from the comfort of home, eliminating travel, reducing wait times, and helping Canadians get back to feeling their best faster. Learn more about Sun Life's virtual healthcare solutions.
All right, so we started out today's conversation talking about COVID. We're going to come back there a little bit here towards the end, and that's when we talk about mental health. Mental health, of course, has been a massive issue, not just this year. Mental health has always been an issue, but it's come to the forefront in the last 5 to 10 years for employers, getting more recognition as an issue as the stigma comes away. And we know that through the pandemic, we've seen a lot of challenges. We've seen spikes, in certain claims, activity, prescriptions, all those kinds of things. We've got lots of anecdotal evidence. So, Dominique, I'm kind of curious, mental health, what can be done in an organization to help workers who are struggling through the pandemic with, being at home and childcare and just feeling overwhelmed with things?
I find this to be a very personal issue. I have a lot of family members who have struggled throughout the years with many different things, and finding support is sometimes a challenge. I think being an employer who is a small team, it's sometimes difficult for people to come forward and tell that they have a challenge that they want to address. So from a personal perspective, one of my family members was misusing alcohol for quite some time. I had to take some time off, and I was very fortunate that my manager was open to that. But it was a difficult conversation to have, to come and tell my manager directly what was happening, and to try to protect privacy, but at the same time be open enough to have them understand why I needed time away. So I think it would be amazing to have some kind of support for employees that doesn't come directly through the employer. Perhaps it's something that they could access directly through the provider and not necessarily have to be so open. I think a lot of people struggle with understanding and with trying to figure out how to approach this. I'm very happy that the stigma in our society around mental health is declining, that we're doing some hard work on making sure that people understand that this is an illness and not something to be ashamed of. So I'm very hopeful that this is something that will continue to get better. But in the meantime, to have some services available to employees that they can access that doesn't involve management, I think that would be very helpful.
For sure. And Frank, from your perspective, what are some of the things that are on the table that can help employees going through this?
Mm-hmm. Yeah, and certainly the key to an employee's well-being is good mental health, and it's everyone's responsibility, the employers, the advisors, the employees themselves, and of course the providers, to really be able to not only just foster an environment where they feel comfortable to be able to access this information. So you could create so many wonderful services and opportunities and make them digital and available. But if employees don't feel, first of all, they don't know that they exist or don't feel comfortable to be able to access them, then they're really not driving what we're looking for. So fostering an environment is really, really important, and that does go through education, support that we could provide. And not only we as insurance providers, but advisors as well, support that we could provide employers on good practices, how they can support their employees, and also educating the employees on the services that are available. Some studies show 60% of Canadians with a mental health condition aren't using their benefits, and and yet many of them do have great resources available. So that's, for us, the first start is really to educate. And then it's really leveraging the services that are available. So there's the employee assistance program that's usually that first step to get going. There's wellness resources. I mentioned Lumino Health Center before, where the employee in their own comfort, taking sort of their mental health in their own hands to be able to access information and services really based on their own comfort level. And there's some services that exist within the benefits program that's available. I'm thinking of online cognitive behavioral therapy that can now, there's really for those that, can't access services, they can do it from the comfort of their own home. So that's really leveraging some of the digital tools now to be able to support employees in their mental health. But it really starts by creating a great environment where they feel that they can access that.
Sure. And Patrick, again, over to you. What are you seeing when it comes to mental health? What are people asking for, and what solutions have you seen that work well?
Well, one of the things that we encourage our groups to take is employee assistance programs. An employee assistance program is completely confidential. The employees can call. It's not the insurance company. They have somebody else doing it for them. And the employer never gets to know who called or what they talked about. And once the employees know that it is completely confidential, and they can call somebody who's specialized in different conditions, okay, who will listen and help them get the help they need. I think that's the first step towards also helping the employer on absenteeism. If you can reduce, if you can catch these things early on where they don't, and instead of waiting until they're disabled, it's much better, right? If they get out right away. For sure, COVID has been a big strain because a lot of conditions are worsened with stress. What we've done as an employer, we were lucky because we were able to assure all the employees that they would keep their jobs. And but a lot of employers weren't in that position where they had to. The employees were wondering, how long am I gonna have my job for? Am I gonna have benefits? And I'm sure it's played a big role in the mental issues that have come up during COVID. That uncertainty, that stress, it's not a good combination, right?